Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology, coming to you with another segment. And I want to talk to you today about a situation that can happen when ladies receive a sling or undergo surgery to have a sling inserted. And a sling is the gold standard of treatment for ladies who experience leakage of the bladder with coughing, sneezing, laughing, jumping, running, things such as that. When a lady undergoes a sling insertion, that's generally a day procedure and it takes about a half hour to do it. Well, sometimes that sling can end up too tight. And what that means is it makes it difficult for ladies to empty their bladder. And then they can sometimes experience more pronounced leakage with urgency and not being able to make it because the bladder is always full because it's not getting completely emptied. That can be associated with a slow urinary stream or perhaps needing to lean forward to empty the bladder or press on the bladder after a sling has been inserted. Now, having said that, what do we do about it? Well, there are a variety of different things that we can do depending on how amenable the lady is to treatment. Typically, what we say in our world is we need time for that sling to scar in place, meaning about 3 months for that sling to really seat in there tightly so that we can go back in, make a small incision, and cut that sling. Basically what that does is it just gives a little bit of room and a little bit of elasticity so that when a lady tries to empty her bladder, it's not so restrictive. And that usually takes about 15 minutes to do that. Now, sometimes ladies don't want to wait 3 months for that because what that means is they may have to use a catheter to get their bladder completely emptied during that time. However, if you wait that amount of time and that sling has scarred into place, what that does is that still allows the physician to cut the sling to give a little more elasticity without the significant likelihood of a return of that leakage with coughing, sneezing, laughing, because there's still enough tension to hold that sling in place and prevent that leakage. Now, when a lady is not amenable to that, or it's just not feasible to do that, sometimes we need to cut that sling or loosen that sling up a little bit earlier. And that can oftentimes cause a return of that leakage with coughing, sneezing, and laughing. So if that is a situation that happens with you, you would need to talk to your physician and weigh those risks and benefits and what you're willing to do and what can be done and what time frame you would like to have that done, and have a very real conversation with your practitioner about what the best options are for you. So, hope this helps. Hope it sheds a little bit of light on a situation that frankly isn't an exact science. Unfortunately, we don't have a dial to know how tightly to tension that sling when we're in the operating room. We go by some standard guidelines, but sometimes with everybody's body being different, sometimes it just ends up being too tight. So having said that, I hope this helps. If you're one of these ladies that suffers from this, talk to your doctor about it because your doctor will be more than happy to discuss the options with you to give you the best possible outcome. Thanks everyone. Keep sending your questions in. And as always, thanks for letting 360 Pelvic Health help restore your confidence.